a story that I'd like to share when it comes to insurance. Janet would talk about insurance companies, and this is more for the healthcare providers out there, but it's still interesting for anybody that doesn't, anybody that accesses the healthcare system, because you don't really know how it works a lot of times. But Janet was telling a story about how health insurance companies will years later they'll say, well, you know what, we overpaid you on XYZ and you owe us XYZ amount of dollars. I've heard sometimes the numbers are 3 to 400,000 with independent practices. I've heard millions of dollars with big corporate clinics. We would get those letters sometimes, and what they would say pay up or we'll take it out of your next check. Of course, we were so, not cash flowing that we needed their check to pay our bills. And so we would wait for those checks to pay our bills. And if they would take money out of there, we would be in serious problems and we would have to probably get more money from the bank, which is not a good way to go. You don't want to go further and further in debt as you get older. That's not a good way to go. Stay out of debt if you can. If not, get out as soon as you can. But we have a story. So after we stopped billing insurance, we got a letter like 2 years after we'd not billed insurance. And it was for oxygen rentals. And they wanted like, I think $15,000 back. So not a huge amount of money, but like 15 grand. And they said the same thing that they'd always said. If you don't pay us, we will hold out your next check. Well, guess what? We weren't getting checks anymore. So guess what? Who was in the driver's seat? It was us. This is very liberating. And anybody that is a healthcare professional and how it feels to get sent a letter like this, listen to this story because this is liberating. Another reason why you shouldn't bill health insurance. So the way they would pay us for oxygen would be they'd pay us a monthly rental fee, and it would be over a 5-year period.
And let's make sure everybody knows you don't just get oxygen without qualifying and having physical or respiratory therapists signing off and doctors signing
prescription.
Off. So it's not like you just deliver people oxygen without the paperwork and the right patient.
Right. And without oxygen, people can die, So very serious. But, healthcare professionals have been abused by these insurance companies for years by just letting them just abuse them and take money away, decrease reimbursement. And but this story is liberating because I was in charge now. There was no way they could get the money from my next check because I didn't have a check. So I negotiated with them. I told them, I said, tell you what, I can pay you a few $100s a month over the next 5 years, kind of like you did for me without oxygen, or I can send you a $3,000 check right now and, get this taken care of. They're like, well, nobody negotiates with us. That's not how this works. But in reality, if you know how the healthcare system works, they negotiate with a healthcare provider. A healthcare provider bills them, let's say $100, but they only get paid $30. So why can't we negotiate with them, right? So they said, well, if you're going to do that, we need to get our attorney on the phone. So they got their state attorney on the phone, and the attorney says, I can't believe I'm even negotiating with you. I'm like, look, I can pay you by the month over the next 5 years, and I might go out of business next year, and you don't get the rest of the money. Or I can just cut you a check for $3,000, which the original bill is like $15,000, and then we can just get this settled. She said, I can't believe I'm agreeing to this, but if you send me a check, if I send you a fax right now, will you agree? Will you sign it back saying you're going to send me a check? I said, sure, I will. So that's what we did. And it was very, very liberating. And I love telling that story, especially to healthcare providers that are on the fence about whether they should bill insurance or not, because that's a good story why they shouldn't bill insurance. Because I know of one right now that's in serious financial trouble because they're getting money taken back from one of the insurance companies from over a couple year period, and it's hundreds of thousands of dollars that they're not going to be able to recover from. So that was very liberating. I'm so glad we got out of that. We don't get letters like that anymore.
No.
And
let's be really clear. None of these clients that they were trying to take the money back, all of them qualified under their standards. So it wasn't like we were dispensing something that was trying to be in any shape or word of fraud. And many times providers are giving services to patients out of goodwill, and then an insurance company decides, well, I don't like this, or they go after a certain group
Yeah.
and they take the money back. And many times, these people are well overqualified for the services that they were given.
Yeah, and healthcare providers have let insurance companies do
Yeah.
that for years, just abuse them, and that's one of the reasons we said no. Back in 2002, we said, "No, we're not letting you decrease our reimbursement by 25%." We said no. We were one of 7 pharmacies out of 1,400 in the state that said no. Well, guess what happened 2 years later? The state came back, and they wanted to decrease reimbursement again, and you know what? I gotta tell the pharmacist, I'm like, "Well, I don't feel sorry for you. You said yes last time. I don't blame them. I mean, most of the people took the decrease in pay last time. Why wouldn't they do it again?"
Right.
So, you
And the
know
margins are really small. It's not like, people have this idea that it's a catastrophic amount. It's not. I think the providers versus if you're talking about healthcare entities, it's not like hospitals. Um, Single providers, physicians, ARNPs, pharmacies, independent pharmacy. We don't have these big margins of profit like some of these other corporations do. So it's not the same. It's just taking the small guy out, in my opinion.
yeah, it sure seems like that because it seems like the big ones are the ones that keep
Right.
surviving. And there might be some underlying reasons for that, but not a we don't have enough time to discuss it on this podcast, but
Yeah.
I do believe that, in general, the federal and state government doesn't want the individual doctors and pharmacists to be in practice. It's easier to control them if they have, a big corporate entity to control rather than one individual practice. So